you folks to retain your good vision is the goal of our next guest on the program. Back with us today, Dr. George Salib from the local eye group, and he's with us today to talk a little bit about what's going on out there. Some cutting edge, no pun intended, way to correct your vision. We're talking about something called LASIK today, and I'm assuming those letters stand for something.
Exactly, yeah. LASIK stands for Laser Assisted In Situ Keratomyolysis. And it's just a fancy name for saying that we create a flap of tissue in your cornea, we lift it, and we do the laser treatment. In fact, it's one of the most exciting innovations in ophthalmology in the last 15 or so years. What we do for a patient is we have them come to your office, to the surgery center basically, have them lie down, we put a few drops in their eyes, we create a flap of tissue in the cornea, which is the very front part of the eye. We use a cool laser to shape the cornea in order for you to be able to see, and then we replace the flap. I usually ask my patients to go home and relax and close their eyes, maybe take a nap, and then by the next morning they have a whole new world in front of them. I've actually had LASIK in my own eyes. That was about 10 years ago, and I thank God every day for having had it. Waking up in the morning, being able to see the alarm clock without putting on glasses, not having to worry about glasses and frames and contact lenses and the associated possible risk of infection. I'm so happy that I don't have to worry about that.
Well, I might say I've had it as well. I've had it a little bit longer. I had it almost 16 years ago now, and obviously the techniques and technology has improved since then. But yeah, that was the first thing that when I woke up in the middle of the night, that first night, or actually early in the morning, the next morning, turned over and could read the digital alarm clock without having to fiddle for glasses. So yeah, it's amazing, and it is life-changing for many people as well.
Certainly.
Is it something for everybody? Can anybody have LASIK, or is it not appropriate for some people?
Well, that's a great question. The main thing that you have to really take into consideration is you have to come to the office so that we can do a full evaluation. We offer complimentary consultations for LASIK. And what we do when you first come in is we first get a full medical history. We examine your eyes in detail. We take lots of measurements with a bunch of fancy machines to determine if your eyes are good candidates and if you are a good candidate. The first thing that's important is you have to be at least 18 years of age, preferably 21. Because if you're too young, then your vision is still changing, and if we do the laser, you'll just have to repeat it later on as your vision changes. Right. Your vision correction parameters have to fall within the parameters of the laser machine itself. We have to make sure that your corneas are suitable for it, like you don't have something called keratoconus, where your eye is abnormally curvy and a little bit thin. And then certain medical conditions preclude you from having LASIK as well. So we have to look at that, your medications, at your whole medical history to determine your suitability.
I know a lot of people know that their vision is down distance-wise. They're having a hard time seeing the signs on the freeway. Right. For a lot of people, their distance vision may still be okay and acceptable, at least good enough to keep getting that driver's license renewed every few years. But for a lot of people, the joke is their arm's too short. You see them doing this in church with a hymn book, or you see them doing, with the newspaper, getting out the magnifying glass so they can read the newspaper.
Right.
If somebody has good or at least normal acceptable distance vision, but is having that near vision issue, does LASIK work for them as well?
Well, it depends how old you are. So up until the age of about 40 to 45, if you have had LASIK before then, you'll be able to see well at all distances. Now, whether you had LASIK or you didn't, usually by the age of 45 you need some reading glasses, unless you were very nearsighted before then. So if you get LASIK in your 40s, 50s, or 60s, for instance, then what you have to consider is, do you want to be able to see up close as well to try to get rid of all glasses, or would you mind wearing reading glasses? If you want to get rid of glasses, then what I would suggest is having one eye corrected for distance and the other eye corrected for near.
I believe that is something that gets done as well with people that have contact lenses, and often the doctors don't tell them that your left eye is the strong eye or whatever, and I understand you test for which is the stronger eye, or which eye is better to be your distance eye and your close-up eye?
Exactly. That's called your dominant eye. There's a special test we do to determine that. We usually have you try it out with contact lenses first to make sure you like that, and that's called blended or monovision. And if you like that, then we can certainly do that with LASIK.
Is there I know as a kid, I can always remember anytime I got a new pair of glasses, because they were very strong, I was very nearsighted as a kid, I'd always get a headache for a couple of days.
Right.
Is that normal in LASIK because you're seeing different now, but you're not wearing glasses? Does that headache situation become a reality?
Actually, no. Most people don't experience a headache at all. I had LASIK in my eyes, as you know, and I didn't experience that at all.
Okay. You're saying that your procedure is all laser, which says to me that not everybody is all laser. Tell us the differences.
Right. There's two main parts to having LASIK. One is the creation of the flap, and the other is using the cool laser to shape the cornea so that you can see. The first part, which is the creation of a flap, is either done with a laser or with a knife, basically, a blade, and that's called a microkeratome. I used to do it with a microkeratome, and that's how most people started out. And now we have a femtosecond laser that can be used to actually create that flap in a very precise and easy way in order to lift that flap and do the laser. So that's what all laser LASIK is.
Let's talk about success rate. Obviously, you'd like to be able to say it's 100%. All medical procedures have some, perhaps small amount that aren't successful. How about LASIK? How successful is it?
You know, LASIK is incredibly successful. I'd say about 95 to 98% of people have great success with it. At least 9 out of 10 people can see 20/20. In fact, I've seen some studies up to 98% of people seeing 20/20 with this procedure. So it's a very successful procedure, and most people are extremely happy with it.
What about length of lasting? Is it going to change as somebody gets it done in their 50s or 60s? By the time they're 75 or 80, is it going to have changed? Will they be back to glasses? Will they be back to contact lenses, or do they need a laser tune-up?
Well, you know, how early you get your LASIK depends on how long it lasts. So when you get into your 60s, 70s, or 80s, then you have to start worrying about cataracts. And then that, of course, will change your vision. And at that point, we'll have to remove the cataracts, and we can put in all these new lenses that allow you to even see without glasses. So at any stage of your life, there's always a good option.
So if you've had LASIK, you are not precluded from getting your cataracts dealt with if that's the case in the future?
Oh, not at all. I routinely consider cataract surgery and do it on patients who have had it.
When you do an eye exam on somebody and you're, say, a new patient, and they haven't given you a lot of information about their eye history, can you tell if they've had LASIK?
In most cases, yes. Sometimes the laser scar is so faint, it's hard to tell. So yeah, I usually ask, and I'm pretty direct about that.
Right. And finally, obviously, like a lot of medical procedures, there may be some insurance coverage, but maybe not. How about paying for this? Obviously, this is a procedure that maybe not all insurance companies are ready for yet.
Right. Some will cover that, some don't, most don't. So there's different ways of paying for it. You can either have like a health savings or flex account, where you take that money out of your paycheck without interest, without taxes, and then you use that for the LASIK. Or you can use it, you can do financing with a company such as Care Credit, which allows you to pay over time without interest. We actually pay the interest by contracting with a company for you. So there's a lot of very good, affordable options for that.
And your staff is good at explaining all those options, I'm sure.
I'm very proud of my staff.
Speaking of explaining, if you have a club or organization here in the community and you're looking for an interesting topic, maybe you want to find out more information about LASIK or something else with eye care, Dr. Salib tells me he's available to speak to your club or organization as well.
I'd be happy to.
That's great. The office number there on the screen, give them a call, 770-1322. You can find out more about, taking good care of your eyes, but also maybe if you're looking for a speaker for your club or organization. As always, thanks for joining us. Good to have you on the program today. See you back here in a few weeks. And we'll see you folks in about 2 minutes with more news and more guests as our program continues for today.